Hi, my name is Sam Soutter. I'm the pediatric surgeon at HCA Healthcare Summerville Hospital. I'd like to talk to you today about what to expect when you've been told your child needs to see a pediatric surgeon and you've been sent to see us at Summerville Pediatric Specialists. First of all, one thing you should not expect to do is to have to wait. Almost everybody who calls in for an appointment can see me within a few days. The same thing goes for the day of the appointment. We try hard to make sure that patients are seen promptly. We know that you've taken time out from your day and your child's day to come visit us, and we know how precious that time is. In the examining room, I try hard to bond with your child right away. Most kids are pretty anxious about coming to any doctor's office, so I try to reassure them, and I promise them that there'll be no ouchies that day. No shots, no needles. We talk about kittens and Paw Patrol and princesses and superheroes, and I promise to give them a sticker when we're done. Then I usually talk to them about the popsicle party that we're going to have the next time I see them. I ask them what color popsicle they want, and I get them thinking about how yummy that day will be. Then the parents and I talk about the surgical problem and what needs to be done about it. We talk about the procedure and the risks and the benefits and the alternatives to the surgery. Whenever possible, we plan for a minimally invasive surgery that uses small telescopes to fix the problem. On the day of the surgery, our wonderful and talented team will welcome you to HCA Summerville Hospital. Our child life specialist works hand in hand with the preoperative nurses to make sure that your child is safe, comfortable, and happy, usually drawing crayons or playing with Legos. Younger kids don't even need to have an IV placed before they go to the operating room. They just go to the operating room with our child life specialist and the rest of the team. They breathe through a plastic mask that they've decorated with stickers and it smells like their favorite candy. Our pediatric anesthesia team makes sure that they're safe and sound throughout general anesthesia and also throughout the recovery room. And I use lots and lots of local anesthesia early in the procedure. That minimizes the amount of general anesthesia that the patient needs, and it also minimizes the amount of postoperative pain your child will experience. As soon as I'm done with the procedure, I come back to the parents, tell them how the procedure went, and I give them easy postoperative instructions. Then it's popsicle time. Your child will return from the recovery room, enjoy their popsicles, and head home. Most patients will require only Tylenol for their postoperative care, and many can return to their normal activities within a day or two. I generally schedule a postoperative visit, either in person or as a virtual visit over the phone, about 2 weeks later to check on your child's progress. But I also encourage parents to call me at any time with any questions or concerns.